Welcome, everyone. My name is Scott Baumgartner, and I'm a senior researcher at Mathematica. And this is a webinar on tools for strengthening two-generation services, insights from the next steps for rigorous research on two-generation approaches project, which was sponsored by the Office of Planning, Research, and Evaluation. To start our webinar today, I'd like to turn it over to Kathleen Dwyer, who is the project officer for NS2G.
Great. Thanks, Scott. Good afternoon, everyone. What a great turnout. My name is Kathleen Dwyer. I'm with the Administration for Children and Families, or ACF, in the Office of Planning, Research, and Evaluation. Thanks. Or OPRE. And I am really excited, thrilled to be co-hosting this webinar with Ascend at the Aspen Institute so we can share the tools that have been developed to strengthen two-generation services as part of the Next Steps for Rigorous Research on Two-Generation Approaches project. For a little background, ACF is the primary human services agency within the Department of Health and Human Services. ACF administers more than 60 human services programs, including childcare, Head Start, temporary assistance for needy families, child welfare, child support enforcement, refugee resettlement, and many more. OPRE studies ACF programs and the populations they serve through rigorous research and evaluation projects. So we've had several initiatives related to two-generation approaches over the years. So 10 years ago, we funded 4 Head Start University Partnership grants to test promising two-generation approaches within the context of Head Start. And back in 2015, we awarded a contract to Mathematica to carry out a project to explore integrated approaches to supporting child development and improving family economic security. And that project consisted of foundational tasks for assessing the landscape of two-generation approaches, the level of evidence for the approaches, and next steps in building the evidence for two-generation approaches. And what we learned from that earlier project was that the two-gen field was really quite early in its development. There wasn't much research on effectiveness, and the field could really be supported by formative evaluations to strengthen program models to move toward readiness for effectiveness evaluations. So the project that you'll hear about today, Next Steps for Rigorous Research on Two-Generation Approaches, or NS2G, grew out of that project. So I'll just note as an aside that for both of these projects, we focus specifically on two-generation approaches that support child development and improve family economic security. But those are not the only focus of two-generation programs, and we don't intend to limit what types of programs people consider to be two-generation. We just had to draw a boundary for the purpose of our studies. So for the NS2G project, our overall goal was to build the evidence for programs that aim to meet the needs of low-income families by intentionally combining services aimed at supporting child development with services intended to improve parental economic security. In 2019, we awarded a contract to Mathematica. We had 3 broad objectives, which are shown here. First, to conduct formative research to better understand implementation, strengthen promising models or approaches, and move toward evaluations of effectiveness. Second, build the capacity of program administrators and staff, as well as researchers, to conduct rigorous and meaningful evaluations of two-generation approaches. And third, address measurement issues to promote learning across evaluations and a better understanding of relevant processes and outcomes of two-generation approaches. So Scott, Nikki, and Kara will share how the project addressed these 3 objectives. But first, it's now my pleasure to hand it over to Marjorie Sims, Managing Director of Ascend at the Aspen Institute.
Well, I can go ahead and start off by simply saying many thanks to Kathleen and her colleagues at OPRE for supporting the learning, evaluation, and research around two-generation approaches across the country. It was such a delight to see, so many faces and names in the chat of, some of my favorite practitioners. When OPRE started its work, the Ascend network had just launched, and we had 58 inaugural network partners And now we have over 540 Ascend network partners in all 50 states, DC and Puerto Rico. And we have some partners in other countries, one in Rwanda, one in Guatemala, and one in Ireland. So you can see that the network and interest in two-generation approaches that lead towards family economic mobility have been really important, and there's lots of interest. So the work that OPRE is doing and will be sharing with you today is really important. And so just a little bit about Ascend at the Aspen Institute. We were founded by Ann Mosley, who's our executive director, as well as the vice president at the Aspen Institute. She came to the Institute about 13 years ago, really thinking about how do you change the discourse at the national level about how you support families holistically. And so we are focused on, developing and supporting leadership at all levels, the community level, state level, and federal level, around economic mobility for families, and then making certain that we're providing the tools and resources to nonprofit organizations, systems leaders, as well as policymakers, that how do you do two-generation approaches? And that's in practice and policy and in systems change. And so what this webinar, this conversation today is about is very important because it's about outcomes for families. That's what we're all seeking, stronger and better outcomes for families. And Ascend is really honored to be able to partner with OPRE and share this information because it's critical to the work that you all are doing. And I hope that you will use these resources as you're going forward. And with that, I'll turn it back over to Scott. Thank you, Scott.
Thank you, Kathleen, and thank you, Marjorie. So I'd like to start today's presentation by giving some additional background on the next steps for rigorous research on two-generation approaches project. And as we give the presentation, I would encourage everybody to share their questions and reactions and reflections in the chat. We are hoping to have lots of time for Q&A at the end of the presentation. The objectives of today's presentation are to describe the work that Mathematica technical assistance providers and two-generation initiatives conducted together on the NS2G project, to explain the importance of intentionally aligning and coordinating services for caregivers and their children, and to provide tools and techniques that two-generation practitioners can use to strengthen their approaches to intentionally coordinating services for caregivers and their children. Before we go any further, though, I just want to make a quick note on terminology. Throughout this presentation, we're going to be referring to two-gen initiatives instead of programs, and that's an intentional choice on our part. The ways that organizations combine services for caregivers and their children are myriad, and the term initiative is something that we use to intend to capture that diversity of how these initiatives are set up. And the tools and techniques that we describe today are designed to be applicative to all of these initiatives. There are, as Kathleen mentioned, 3 of us presenting today. So my name is Scott Baumgartner. My pronouns are he and him. I'm a senior researcher at Mathematica, and I directed the NS2G project. Nikki Fung is a researcher here, and she led formative evaluation activities with 2 initiatives. And Kara Conroy is a senior researcher and led the measurement development for the NS2G project. NS2G included 3 specific objectives to help achieve the overarching goal of building the evidence base for two-generation service delivery, as Kathleen stated. To achieve those objectives, NS2G included 3 primary activities. So for the formative evaluations, we used a structured learning process and provided intensive technical assistance to 4 initiatives. And Nikki is going to talk about this work. To build evaluation capacity, we facilitated a learning community of 10 initiatives. And to address measurement issues, we developed and tested a draft measure of two-generation initiative functioning, which is the focus of Kara's presentation. The 10 two-generation initiatives we partnered with on these activities are shown on this slide. From the learning community to the formative evaluations to the measurement pilot, NS2G was a collaborative project. We engaged two-generation initiatives in all aspects of this work, to make the findings and tools as relevant and useful for practitioners as they could possibly be. If any of you are on the call today, I also encourage you to chime into the chat or when we get to the Q&A to share your insights and perspectives. This project would not have been successful without your full participation, and we appreciate you. The goals and objectives of NS2G all come down to learning. Formative evaluation is intended to strengthen the implementation of an intervention. This type of evaluation enables practitioners to define the key features of their initiative, develop a logic model, understand participant satisfaction and engagement with services, identify barriers to participation in services and areas for improvement, and come up with solutions to their challenges. In a moment, I'll turn it over to Nikki to talk about the formative evaluations. She'll describe the Learn, Innovate, Improve framework that we use to guide our work. And she'll share with you a template for a logic model that we co-created with participating initiatives. Logic models can be intimidating, but they can also be powerful tools to help you sharpen your approach to serving caregivers and their children, identifying ways to strengthen your approach, and know whether you're accomplishing what you set out to do. So Nikki, the floor is yours.
Thanks, Scott. I'm so excited to talk about tools for strengthening two-generation approaches today. Let's go ahead and move on to our next slide. As Scott mentioned, LI Squared, or the Learn, Innovate, Improve framework, is a framework for program improvement developed by OPRE and Mathematica. We used this framework to guide formative evaluations on the project. As the name suggests, LI Squared involves 3 phases. The Learn phase is about identifying a focus area for program improvement. On NS2G, pairs of TA providers worked with each participating initiative to conduct virtual site visits, collaboratively develop a logic model, and identify opportunities to strengthen the logic model. In the Innovate phase, TA providers and initiative staff collaboratively developed evidence-informed strategies to address the opportunities they identified to strengthen in the logic model. Finally, in Improve, we used rapid cycle learning to test and refine those strategies. Rapid cycle learning is a method for quickly and iteratively testing program improvement strategies to strengthen their design and implementation. Let's talk about the logic model. So as you all know, the logic model for primary caregiver, integrating services for primary caregivers and their children can result in better outcomes than those accomplished by serving each generation in isolation. And mapping out these services in a logic model is a powerful way for two-generation approaches to articulate intended outcomes and related services for families. So this is a template for a two-generation logic model that we developed on this project. We developed and refined this model with the programs as part of the Learn phase with the initiatives. So when completing this logic models, initiatives considered the characteristics of families in the initiative. For two-generation services, it was important to think about who an initiative is serving, how they're motivated, how they interact with each other. Researchers in the two-generation field call this mutual motivation. So for example, one NS2G site identified that families were eligible for Section 8 housing, and parents and caregivers were identified as single parents, and most were already pursuing post-secondary education. Next, they considered adult, child, and family services. The model asked initiatives to articulate services for each generation and question whether they're all high quality and intensive enough to achieve the outcomes in the logic model. If they're not, that was an opportunity for improvement. So one NS2G site identified co-location of housing and the Early Childhood Education Center as another service offered to the household. Mutually reinforcing services was also considered by the initiatives. This is how services for caregivers and their children are intentionally coordinated or were aligned and build on each other to help families achieve their goals. For example, one site identified that the family-centered case management was a mutually reinforcing service. And we also asked initiatives to consider foundational values. The initiatives thought it was important to highlight how they worked with families, and it was just as important as the services they offered to the families. So for example, one NS2G site said a foundational value was that families are experts in their own situations, and staff practice a no wrong door approach. Initiative staff also identified short and longer term outcomes. Here are a couple outcomes one NS2G site identified. The staff and TA liaisons at each NS2G initiative worked together to develop and refine a two-generation logic model that described the initiative. They then shared the logic model with a small group of initiative staff, frontline staff of partnering organizations, and directors of partnering organizations to review the model. Let's talk about identifying implementation challenges. So initiatives participated in a set of collaborative workshops with 5 or more initiative staff. These workshops wrapped up the learn phase activities from LI² by asking this broader set of staff, including administrators, supervisors, direct service staff, and key partners, to review the logic model and brainstorm challenges related to components of the logic model. This could suggest areas where program implementation could be strengthened. Engaging a group with a variety of perspectives and expertise, such as including participants, can help uncover areas for improvement, identify hidden assumptions, and service biases in areas for marginalization or exclusion in initiative services. The examples from the previous slide are from one NS2G site. When reviewing the logic models, staff at this site discussed how, despite having a wait list of participants, housing units would remain available. They wanted to assess what caused delays to filling units and whether their no wrong door approach minimized burden on participants who have to repeatedly tell their story before they can access the family-centered case management. After identifying challenges to implementation, the workshops transitioned into the innovate phase, the last phase of LI². So this larger group of staff worked together to come up with some potential solutions. After the meeting, the TA providers worked with the initiatives to refine these solutions and developed a detailed implementation plan. So to develop the strategy and plan for rapid cycle learning, initiatives completed a worksheet that NS2G TA providers together. The worksheet asked initiatives to document the detail of their strategy and how it aligned with the challenge they identified to confirm that it could result in change and address the challenge they were focused on. In particular, the worksheet asked initiatives to articulate 4 things. First, what was the challenge? To identify appropriate strategies to address the key challenge identified, practitioners need to understand the underlying factors that contribute to the challenge. Next, we asked them to articulate, or the worksheet asked initiatives to articulate how strategies would address the challenge they prioritize. So we asked initiatives to consider what they hoped would change by implementing the strategy, how they could tell in the short term whether it was working, and to anticipate obstacles that might get in the way of success. For initiatives, it was helpful to frame the challenge as an opportunity, such as how might we develop improved standardized process for referrals and monitoring within our integrated data system to better serve participants? Or how might we improve onboarding and professional development so all initiative staff approach their work in the same way and have opportunities to grow? Initiatives also considered how they would implement the strategy. Considering this question helped initiatives get clear on all of the details of the strategy, including who was responsible for what, how they would create the conditions for staff to be successful in implementing. So for example, what supports would supervisors provide? What could they do ahead of time to address some of the obstacles they identified? Initiative staff have several responsibilities that compete for their time and expertise. So confirming these details held them accountable for implementing the strategy and assessing its progress on the timeline that was useful and responsive to the initiative. And finally, they also identified how they would use rapid cycle learning to test and refine the strategy. So we worked with initiatives to develop a timeline for testing the strategy, including when to come back together to assess progress. So an important part of rapid cycle learning is data collection and learning to generate and use data in decision making. So the worksheet also includes questions about how you will know that you're on the right track with your strategy. Learning cycles can be short, so the things you want to look at in rapid cycle learning are short-term outcomes and process changes. So things like satisfaction with process, enrollment, participation, and referrals. It's helpful to think about rapid cycle learning as a process for strengthening implementation and operation of a strategy. It is not to be used for determining effectiveness. It's always good to collect data from multiple sources with anything you're trying to learn about. So the NS2G initiatives used a mix of qualitative and quantitative data. They used staff and participant interviews or focus groups, low burden surveys, and administrative data. Here's an example of how rapid cycle learning could look like in practice. It's a hypothetical example informed by the NS2G site we've talked about earlier, who wanted to revise its enrollment forms to make it less burdensome and intrusive for participants. In an initial improvement cycle, the initiative had a few participants fill out a revised form. After they completed the form, the participants provided feedback on their experiences to program staff, such as the parts of the form that were difficult, repetitive, or confusing. The initiative did this for about 3 to 4 weeks. And then the initiative had a team discussion to go over what they learned. Here, they also talked with a housing partner and learned that some of the redundant items and some of the language on the form was actually required by federal law and couldn't be changed. So for the second improvement cycle, they changed their approach. Rather than having participants directly fill out the form, they had staff go through the forms with participants and fill it out together. Again, they talked with participants about their experiences, and they had individual discussions with staff about the time it took to hold the conversations. Something the initiative was really interested in was whether this more conversational approach to help participants establish connections with staff. In the second cycle, they tested the strategy for a little longer, 4 to 6 weeks, to have time to practice those conversations with more people. After this cycle, they get together again to review the data. They might learn that the conversation does help establish relationships, but it's hard to find time for those conversations. In a subsequent cycle, they might try to shorten the interview period or try a hybrid approach or reduce staff responsibilities to make room for these conversations to happen. We'd like to share a couple QR codes that will link you directly to these resources that we've talked about. We've got a QR code for the logic model, for the worksheet that I talked about that asks those specific questions for your strategy, and then some tips and considerations for conducting rapid cycle learning. As we've discussed, slides will be shared, and there will be another QR code at the end of our presentation that will take you to all of these products. I'm very happy to turn it over to Kara next.
I am happy to share a little bit today about one of the specific tools that we developed as part of the NS2G project. And that tool is the Mutual Reinforcement for Two-Generation Initiatives measurement tool. So as Scott mentioned, one of our objectives within NS2G was to develop and test a draft measure of two-generation initiative functioning. So the measurement tool that we ultimately developed was designed to capture mutual reinforcement. So we're going to start with what that term actually means. So mutual reinforcement occurs in two-generation initiatives when service providers align and build on each other's efforts to serve whole families by adopting a shared vision and working toward common or compatible goals. These efforts are intentionally coordinated to make use of each provider's strengths of expertise. And Scott, you can zoom through these animations for me here, but they can include designing and offering services of high quality and appropriate intensity to caregivers and children in the same families, developing and using shared measures to assess both caregivers and children in the same families, or developing a common theory of change or aligned mission statements to positively affect both generations within a family. And the reason we want to try to measure this is that we hypothesize that mutual reinforcement is necessary to achieve broader shared outcomes for both generations. So beyond what each individual service provider would be able to achieve on their own. So that's what led us here to the measure that we'll share with you today. Next slide. So the mutual reinforcement measurement tool, which I am happy to say is currently available on the OPRE website, includes 14 sets of survey style questions, and it takes about 30 minutes to complete. So after answering the 14 sets of questions, the tool generates 4 scores. So the first is an overall mutual reinforcement score, and then a score for each of 3 subscales that are included in this tool. So the 3 subscales capture the extent to which all partners first are aligned on vision, mission, and theory of change. So that's the principles subscale. Share common or compatible goals for serving whole families, common measures or indicators, and have systems in place for sharing data. That's the infrastructure subscale. And then finally, it captures the extent to which all partners offer services of comparable quality, duration, and intensity to caregivers and children in the same families, align and build on each provider's efforts and activities, and leverage each service provider's area of strength or expertise. So that's that third subscale focused on service delivery strategies. And all scores, so the overall mutual reinforcement score, and then a score for each of those 3 subscales, range from 1 to 5. And just a note here that we've designed the tool so that higher scores indicate stronger levels of mutual reinforcement. But this tool and its scoring methodology are preliminary and not yet validated. So while we assume that improving scores coincide with strengthening mutual reinforcement, we don't know yet what scores translate to emergent, strong, or exemplary levels of mutual reinforcement, and some more testing is needed after our NS2G project. So despite this early stage of development, we're still releasing it now because we believe it's a promising tool for 2-generation initiatives to use to identify any areas where they could strengthen their approach. And we wanted to share some of what we heard from staff who piloted the measurement tool as we were developing it. So one staff person from a 2-generation initiative that participated in the pilot said, "This tool would be useful for us and our partners. We like seeing where gaps in knowledge or communication might be, and it's not a big time ask to fill this out." Another said, "We do monthly report outs, so it would be helpful to say as a collaborative, we started here and now we're here. It would help us with relationship building and seeing it as something we're doing together, not as a siloed approach." And then finally, here's what one staff person shared about working as a group to complete the tool. They said, "Completing the tool as a group was really an aha moment for us and how we could approach this in a holistic sense. Now we have a monthly meeting set up to discuss data, programs, and reporting together." So you can visit the OPRE website for more information and supporting materials, including demo videos that walk you through how to use the Excel workbook. So there's a QR code here on the slide that will take you directly to the page where this measurement tool is hosted. We can go back to any of these QR codes, and like Nikki said, we'll be circulating this slide. So this is not your last chance to grab the link to that tool. Next slide here. So based on what we learned in our pilot study, we want to share the steps that we suggest you take to complete the tool. So to start, we really recommend that you work together with your colleagues. It can be really challenging for one person to have all of the answers. So sitting down with your colleagues to discuss the tool could help you and your partners identify what your shared 2-generation initiative is doing well and where and how you might improve or strengthen what you're offering. So here's a 2-step process that you might follow. So we tested step 1 in our pilot, but we didn't test step 2. Instead, we created step 2 based on input from the staff that participated in the pilot about how they envisioned using the tool with their partners after they, left the pilot and had the tool available to themselves. So for step 1, we suggest you complete the tool within just your organization. So even if you partner with several organizations as part of your initiative to serve whole families, really focus in step 1 just within your organization. So each partner organization within an initiative should complete the tool internally with key staff. In the pilot, it worked well when 3 staff were involved, including someone who was familiar with how the initiative uses data. And then using the results, those three staff together can identify improvements that would strengthen mutual reinforcement with an emphasis on their individual organization's contributions to the initiative. And staff would use their responses to question 1 in the tool, which many of you don't know what question 1 is, but it asks you to list all of the distinct 2-generation partners that are involved in your initiative. So using that reflection of who do we work with as part of our 2-generation initiative to determine who should be involved in step 2, which is an initiative-wide reflection where you get together with everyone who's involved in delivering these services. So in step 2, representatives from each partner organization, including staff who are authorized to envision and implement process change within their organization, would meet to discuss the organization level results that they generated as part of step 1. So using the collective results, partners would determine improvements that they can make to strengthen mutual reinforcement across the initiative. And the arrows in this graphic are meant to represent our recommendations to repeat this process at regular intervals to understand how your initiative's level of mutual reinforcement might change over time. So it might be helpful to repeat this process as part of annual planning or when you make changes to your logic model or key processes or services. And I think I will turn it over to Scott for questions.
Thanks, Kara and Nikki. So at this time, we are happy to take questions. You can either put your questions into the chat, or I believe you can come off mute to ask your questions as well if you prefer to do so. We can start. Marjorie had one question for Nikki. And the question is whether you could share more timeframes for rapid cycle learning or whether all of the cycles are always 3 to 4 weeks long.
Thanks, Scott. Marjorie, was there anything you would like to add to your question?
No, I'm just really curious about the timeframes. In the slide, you had one that was 3 to 4 weeks, and I think one that was 4 to 6 weeks. Is there a good time frame when you're thinking about assessing, what you might be learning and gathering?
Yes, Marjorie, I love this question. Thank you for asking it. Rapid cycle learning is meant to be iterative, responsive, and aligned with your strategy. So those are all things to consider when you're considering how long to run your cycle for. We've definitely seen it as short as 2 weeks, 3 to 4 weeks, anywhere up to 8 weeks. But you want to keep in mind that you want it to be responsive. So thinking about how much information you might need to make a decision and how you're collecting that data, right? If you're sending out a survey to families, can they respond in 2 weeks? That might be kind of difficult. So make sure that you're considering those factors and setting up and deciding on how long your timeline is. But keep in mind, it is meant to be short.
Super helpful. Thank you.
Sure.
If I can add just a little bit, I think, one thing that we learned through this project is that a lot of 2-generation approaches tend to be fairly small. And so one of the challenges that initiatives encountered was actually collecting enough data. And so a couple of them ended up extending the length of their cycles or testing the same thing over multiple cycles to try to gather enough information. So it really is a balancing act to figure out, you want this to be rapid, but you also want to make sure you're gathering enough information to make an informed decision on what your next step can be. And the initiatives that participated in NS2G, when we asked them about this, and they told us actually what rapid meant to them with rapid cycle evaluation is also the speed from which you go to talking to doing and moving into actually having these conversations as a team about how to improve your initiative and moving into doing something about it and trying something new. And that was beneficial as well. Just to sort of reiterate also what Nikki said is you could think about the thing that you're testing and the thing that you're trying to improve and use that as like the springboard for determining how long you want to test something out. So if you're really trying to improve something like enrollment, a lot of initiatives, a lot of programs tend to measure that on a monthly basis. How many folks are you bringing in the door every month? So a month is like a good time frame for that. If you're testing something like an approach to how you do something within a workshop, or it's something about participation in workshop completion, you may want to test something for the length of one workshop, whether that's, it's a quick 2-week thing, or whether it's an 8-week workshop with a curriculum. You may want to match the length of your cycle to the time frame of the thing that you're testing. Okay, I see some other questions in the chat. Minnie asked whether we could explain the self-sufficiency matrix. And I think this question is coming from the logic model examples. Is that right, Minnie? Or is there anything, if you are comfortable coming off mute and sharing a little bit more about your question?
Sure. I come from the workforce side of the house. I work for the Employment and Training Administration, Department of Labor. So one of the big challenges we have when we have customers coming in to get a job is sort of that cliff effect. How are you, if you lose your benefits, taking the job, kind of like the pros and cons. So I was just sort of interested in terms of from the cliff benefit perspective. I was just curious what you meant by that sort of self-sufficiency matrix that you use.
I can take this question, Scott, because I think this is coming from one of the sites that I worked with. Minnie, thanks for asking this question. So this came from, there are, self-sufficiency matrices online, and we can certainly follow up with the site whose logic model this was to make sure that you have this, version that they base theirs off of. But part of their family-centered case management approach was not to just look at what are early childhood education outcomes for the children that were involved in their initiative, or for the caregivers that were involved, maybe like educational or employment, but a lot of other outcomes and domains that they were interested in when really thinking about the family holistically. So that included things like housing, like food, like healthcare coverage, and life skills. And they used a matrix where it wasn't just a binary yes, no, like they've gotten to this point or that point, but really viewing these domains as a continuum. And one thing that was also unique about this approach was rather than telling all families, you need to get to a 5 out of 5 on all of these domains, they worked with the families to set goals for themselves. Where do you see your family in the next year? Where would you like to be, along those domains? So this is not one of the tools that we developed. There are family self-sufficiency matrices, kind of out there in the ether. And one of the initiatives we worked with used one in their case management approach. That's why you saw that on that example.
Thank you.
Yeah, I think they all use self-sufficiency matrices, and they may have all used different ones, whether they were ones that are out there or ones that were more homegrown. But I think they were included components related to the, the adults in the family, the children, and the family as a whole. Corky asks whether or will the data or resulting report be available to show how universities can engage in the two-generation approach. Many undergraduate students are also parents and may be the first person in their family to pursue and obtain a college degree. So how can I apply 2Gen to the university setting to improve retention? So I will take the first part of this question and say that these are out there. We have the QR codes in the presentation, and so we would love for you to go read the final report or the briefs that Nikki mentioned, and see how they apply to university settings. I know that 2Gen is something that a lot of universities have engaged in, working with student parents and through parent centers. Kara, I want to kind of come back to you because the initiative you worked with parents who are in post-secondary ed.
Yeah, Corky, thanks for this question. So one of the sites that I worked with was out of Kentucky, and the the State Housing Authority had created a program. I think there are 9 sites, maybe gone to 11 now, that works with parents that are either already enrolled or interested in re-enrolling in higher education. So the program is a partnership with a local community-based organization, the housing authority, and then also several post-secondary institutions in the state and kind of near the local area. So the design of that program is that there are parents who are enrolled in post-secondary education that have young children, and there's a co-located early childhood center on site where the parents are living in housing there. So there are certainly models out there that are really designed specifically for parents who are also pursuing post-secondary education. But in my view, that's just one. And I think there are many parents involved in post-secondary who may not meet that exact profile, who would certainly benefit from those types of supports.
Karen, Scott, do you mind if I just add something? Because I put something in the chat and I responded to Renee, but the message was actually for Corky, and would love to hear from anyone that's on the call that's actually working with students who are parents. But Ascend has been doing an initiative over the last 6 years that's focused on students who are parents and their success through post-secondary programs. So I put a link in the chat to the information on our website. We've developed lots of strategies and tools for community colleges as well as workforce programs and how you can support students, their retention and a completion of those programs. So just wanted to add that. But I know there are some folks on the call that actually, do work closely in university or college settings as well as with students who are parents.
So I want to come to Renee's question next. And I think Debbie has a related question or reflection. And it's about the capacity building components of these tools. And so Renee asks, have you found that initiatives need to have a certain level of capacity in order to take on this work? And she observes in educational work that sometimes the schools that need the most help aren't in a place to be able to take on this kind of work. And so what kind of baseline capacity have you found is needed to get started and be successful? And Debbie makes a similar observation, is making the time and finding the focus to evaluate the work we're doing while we're trying to still do the work. And it's tough to find the money for external evaluators who could guide us through the process. So I want to thank you both for those observations. Those are real concerns and real challenges. And I think, something that the initiatives in NS2G appreciated was our role as sort of these accountability partners and making sure that you create the time and space to sit down and think these things through. Because I think that that's the number one capacity is finding the time and space and reserving that time to have these discussions. I think all of these tools are designed to be used without our help. And our goal in this work was really to, while we were guiding initiatives through the formative evaluations, develop these tools with them and teach them what we were doing along, so that they could take and run with these kinds of tools and techniques on their own. I don't know, Nikki, whether you have anything to add to this question based on your work with some of the formative evaluation sites.
Thanks, Scott. I'll highlight a takeaway I had from working with the 2 sites that I had the opportunity to work with. Working through the worksheet that I discussed to structure their rapid cycle learning made it feel very bite-sized and accessible to think about. When you think about rapid cycle learning, it's these, 3 big words that could feel really large and overwhelming to take on. And one of the sites that I worked with emphasize that, getting that specific, having something to walk them through that strategy, creating a timeline, making assignments on who was going to do what was really helpful to make it feel really accessible and to feel like they could go back and do it themselves again. Thanks, Scott.
Thanks, Nikki. And I think, Scott, you mentioned
Yeah, and I will just add too, I think, one of the things about rapid cycle learning that we try to emphasize is particularly with like collecting data and evaluating and having these conversations between learning cycles is we think really intentionally about how to build those into structures that already exist. So how can you use a staff meeting, do a little bite-sized activity in an existing staff meeting to identify, say, a challenge that you want to work on? Or how can you, say, if you have supervisors meeting with case managers or other staff who may be participating, how can you use those to collect data? How can you use the tools and resources that you already have so you're not layering on? So evaluation is built into what you're already doing rather than an added extra. Is that helpful? I want to make sure, Renee or Debbie, if you have any additional thoughts or comments or follow-up questions, that you have a chance to come off mute and ask. Okay, if not, Nicole had a question about, she's curious about how this can be adapted for grandparents raising grandchildren. This is a great question, and I just want to highlight Kara's response in the chat that we were really intentional in this project about using the term caregiver because we recognize that families look very different. And we wanted to try to capture the many ways that someone may have come to be a caregiver, whether they're a grandparent or through some other way. Deborah asks, how do we learn who or what agencies are already collaborating in our region? And we cover 5 counties. Marjorie, this feels like a question tailor-made for you.
And what are the what's the area? I'm sorry, I can't see it in the chat.
It just says 5 counties. Deborah, I don't, if you're willing to come off mute and share a little bit more.
So I will just share, and I know that Brendan Creamer, who's our comms manager, is on the call. He can put a link in the chat to our map on our website, which is by state, and you can see all of the organizations, people, fellows connected to Ascend that are taking 2-generation approaches in your area. But Deborah, where are you located?
We're considered the Upper Peninsula of Michigan.
Oh,
We're
wonderful.
across the bridge, like Detroit's below, and then you got to cross the bridge and come up to us. Yeah, and then we have 5 counties in that area. And we have other, our agency does spread across the whole UP, and we have other programs over there also.
Yeah, are you a community action agency?
No, actually family preservation. We're doing
wonderful.
families
Yeah,
together
so,
building solutions right now, but we have foster care and adoption and post-adoption.
oh, wonderful.
Other
Wonderful.
programs.
So you're working with the Michigan Fed?
Yes, it's been an exciting process to work between the department and the Federation.
Yep.
And I saw a few faces in here today that were familiar, and I've been trying to not get on stage here. I didn't want to do that. I wanted to just listen, but you put me on the forefront. But
no, but you've got
an exciting process.
Absolutely.
And we have been looking at who all our collaborators are, but I'm in that boat. Like, I don't have the time or the job description to do all this work on my own from where I'm at, but I'm to do these measurements and stuff. But as an agency, we're working together to try to figure it out.
Yeah.
And So I'm like trying to figure out who would we connect with? Who's already connected with you guys? You know, who's already collaborating, and how would we go about this?
Yeah, we're definitely working with the Michigan Fed. We work with the Department of Human Services there. We're working with the Kresge Foundation as well as the Steel Case Foundation. We have fellows at both of those foundations that are very, committed to the two-generation approach. And so one of the things that we've always found very helpful is connecting people within places. So across counties as well as at the, across the state, and would be happy to connect with you to figure out how we can make those introductions so that you have a network of support. So you can reach out
and
to
I
me.
see like Janet down in my corner. I see Janet Reynolds down Slinger over here in my corner.
Yeah.
I saw Greg's name. And so they're all connected. I know that. I guess I was just looking at like more locally, like,
yeah.
I know we go with the health department, we go with the early on, we do this, we do that, but what other agencies are already directly working, or how could we connect so that we can get some numbers for you?
Yeah, that's a really great question. And Janet's on the call. Maybe we can connect, separately and figure that out. Who else is in your community that we can connect you with? I'd love to do that. Okay.
All right. Thank you so
much. We'll reach out. You're welcome. All right. Thank you.
So I just want to follow up on the previous question about making time for this work, and that it can be a challenge. So Kara, I didn't know whether you wanted to jump in with your observation. You had a helpful reminder to me.
Scott, thank you. I was like sitting here typing, but it's probably best just to come off of mute. So Debbie, I just wanted to acknowledge, I don't want this to feel like we're saying just make time for it, because we know that making time is really challenging given how many ways that you all are trying to show up for families, and blending services in a way that sometimes feels like you're swimming upstream in a way that can feel challenging. But we've tried in a couple of the tools that we've released, and I'm thinking specifically on the brief, and we can share the link in the chat, about using a structured learning process to strengthen two-generation service delivery. So that's related to what Nikki shared about rapid cycle learning. But in that worksheet where we ask people to document what their change strategy is, there are guiding questions to fill out together with whomever you're working on this with, to say, how will this get done? So listing the supports that you would provide for successful implementation, and really designating like who owns each small step of this process that we're going to do together. Acknowledging that sometimes when you have someone who's a champion for something, or maybe just owns a small piece, there's some accountability there to know that this is the piece that I said that I would do and have ownership over. So it's not much, but it's something that we've tried to include a way for you all to work with your colleagues to say, this is the piece that I can take, and this is how I'm going to get this done, or support my staff to make this change.
Kathleen, I see your hand is raised. So
I
please.
did. I raised my hand. I also wanted to get back to that question about capacity and time, because I want to make the caveat that we did have criteria for selecting the sites to participate in NS2G. So there was a baseline of some capacity for participation. So, the sites that participated were implementing two-generation services over time. They weren't in a planning phase. They had some capacity in their administrative data. I think they all could link between children and caregivers at the beginning, or at least they were developing that capacity. And they had all participated, I believe, in some previous technical assistance to strengthen services. So these were programs that had some capacity to start with. And we worked with these programs to develop these new tools that we are intending to be used on their own, although we're all acknowledging it's nice, it's very helpful to have the scaffolding and the accountability partner, but just to acknowledge that we didn't actually try this out with programs that didn't have capacity. So I just wanted to acknowledge that.
Yeah, thank you for that acknowledgement, Kathleen. So Dwayne has a question here about, are there any thoughts about structuring data and processes to start looking at long-term results? I guess I would like to open this one up and see whether anybody has any reflections for Dwayne. Or Dwayne, if you wanted to add any context to your question.
If my audio is working, I'll be glad to just add this. So I put my response, I don't think it was Dwayne, it was Corky maybe, about this. We work with single parent students for the last 26 years, and we are fortunate within our organization to have a couple people that work with multiple programs, including ours. And we have been using a software system for our case notes and intake information and documents, and working with the team there to sort of have some data points automatically entered and collected as we go. And so that has allowed us over time to collect those. And then we do, normally our resident participants are with us about 2 years. So when they exit, we do follow-up surveys at a month, 6 months, a year, 5 years, and 10 years. So we have been collecting some of that long-term data, and it has been, number one, really inspiring for our staff to see that and that generational impact. But it's also been really useful to us to identify service improvement, but then as well to be able to uphold this field and the work we're doing for further support. So I mean, I feel bad saying that in a way, because it's like, yeah, hey, we have some resources and support here that we've been doing a long time, but I think it's entirely doable. And I think it really supports the field when we do that, to show the outcomes and that actual generational impact, because some of those children we began with now, as you can imagine, 26 years later, are grown and on their own. And we can see the literal second generation adult impact on those families. So I think it's entirely worthwhile, and it's definitely doable. And I know our time here is limited, so I'd be happy to talk to anybody further about, how we've managed that, because I'm not going to say that system is perfect. No software is, but it is usable.
Thank you for jumping in, Marissa. That's
Yeah.
helpful.
This is Dwayne, and that was helpful. My thought was that, as a sector, if we can start thinking about what it is and how we want to do some of this work long term, now's the time to really start doing that. And I think, that what we get out of that is exactly what we just heard. Much bigger impact, probably acceptance. It's just we're at the point now where we need to start thinking about how we're going to do that. Thanks.
Yeah, that's a important comment, Dwayne. I will add, I think, as Kathleen mentioned, one of the pieces that for the initiatives that participated in NS2G, one of the things that we asked about and wanted the initiatives to have was a data system that could link parents and children, or caregivers and children. And so that's really important. thinking about how services for one generation may affect the other generation and be able to track those family outcomes. So that's a really, really important piece. And as we saw through the learning community, we did not talk a whole lot about the learning community in this webinar, but that was one of the pieces that all 10 of those initiatives were really working towards over the course of this project. And that was one of the areas for growth. And there are, more and more, services coming online to do that. The other thing that your comment, Marissa, was making me think of, and Dwayne as well, is like how essential the logic model is developing that logic model and how you use the logic model. That's where you're thinking about like what are the key outcomes that you want to track? What are the most important outcomes related to the services that you're providing, and doing that work to think about what those are, and then think about, okay, well, how are we tracking those in those systems and making sure that those things are aligned is really something that is foundational. So that's the other comment that I'll make as far as that goes. Are there other questions?
I just want to follow up to what Dwayne was saying. I love the concept of that sort of standardized, to some degree, approach to how we're measuring things so that we can kind of present that unified front. I'm intrigued by that idea.
Are there other comments or questions? If there are none, then I will.
Scott, I actually have a question. And that is, having, done a lot of this work over the last number of years, has there been anything that surprised you about the organizations that are taking two-generation approaches, or other opportunities you think should be pursued with respect to learning and evaluation of two-generation approaches?
It's a good question. I have to think on that for a second.
I have one thing to share quickly, Scott, while you're thinking. And Marjorie, this was something that surprised me, but maybe shouldn't. And I think it's an example of, where we as researchers and TA providers really learned from the initiatives that we were working with. And the first iteration that we were working on with that two-generation logic model template that's included, in our presentation and what we'll share today, it was good. It was solid. It was well aligned to, research in the field. But one thing that it was missing was that foundational values box that you'll find that's on the version now that we've made public. And that was something that the initiatives really pushed us to add. That was crowdsourced from the work that we were doing with them, where, we got to the end of this process where we developed this logic model to document what services are they providing to families, what do they expect the short and long-term outcomes will be. But there was nothing really about like, how do we every day show up for these families, and how do we think about how we're going to serve them and be partners to them in this journey that they're on. And I would say it was like very eye-opening. And to me, when I look at those logic models, sometimes those foundational values box tell me as much about a two-generation initiative program than looking at, all of the services and outcomes that they listed there. So that's just a plug in your logic modeling to leave some space for that and some reflection with who you work with.
That's wonderful. Thank you, Kara. Really wonderful to hear that.
Thank you for sharing that, Kara. That was one of the things that was on my mind. And so I'm glad you brought it up. The other thing, Marjorie, that I will note is that, and I wouldn't necessarily call this surprising, because it's definitely something that Ascend has emphasized. But when we sat down as a team to look at all that NS2G had accomplished and what the different initiatives in this project had tested and what they'd worked on, they're all initiatives that structured themselves fairly differently. and operated in different places around the country, and had their own specific context. But a lot of what they were working towards was intentionally creating supports and building capacity for the staff involved in the initiative. And it really got back to me that like mindset, that 2-generation mindset that staff need to have, is really so essential. And like that's what rose to the top for all of these initiatives. How can we create space for case managers to have meaningful interactions with participants and really embody those foundational values of treating families as the experts in their own situations and in their own goals? How can we create space with that? How can we make sure that when an internal referral is provided, how do staff follow up on that? And how can we make sure there are structures in place to avoid families falling through the cracks and things like that? So that was just one finding that stuck out to me from this project.
That's really helpful to hear, Scott. Really appreciate your sharing that. And it is something that we're hearing more and more across our network, of the importance of having a staff person who can serve as kind of that coordinator around 2-generation approaches, but also very much centering the well-being of staff, right? Because of everything people have been through, but the sheer, just kind of the additional intentionality that has to happen when taking a 2-generation approach.
Scott, if I could add too, one important step in those collaborative workshops that we did with the initiatives was reviewing that logic model and talking about the foundational values. I think the foundational values in reviewing the logic model also provided the opportunity to initiatives to reflect on the things that they were proud of, the things that they felt good about and that they did well. I think in talking about capacity and talking about finding time and brain space, we often don't have time to think about what we're doing well and give ourselves a pat on the back. So I was really happy that we were able to offer that opportunity to the initiatives we worked with.
Yeah, thank you, Nikki. So Laura just asked, will the logic model be shared with materials from today's meeting? And I think that's a great segue here to this list of products that we've been able to put together from NS2G. So we have, and I'll just go through this slide quickly. We have a brief on defining a 2-generation logic model, and it includes a template for the logic model in a version that you can print out and fill out, hard copy, or I believe it's available as an editable PDF, so you can download it and work on it with your team. And the brief has kind of some step-by-step processes that you can follow for how to complete that, and some ideas for activities to identify the things that should go in that logic model. We also have a brief that covers using a structured learning process to strengthen 2-generation service delivery. And Nikki explained the worksheet. So we've made that worksheet available again as a fillable PDF. And we talk about some activities that teams can do together to identify implementation challenges based on their logic model and come up with strategies that might address those challenges. We have a brief on using rapid cycle learning to build momentum for change in 2-generation service delivery. And this contains some of the reflections and considerations for practitioners who want to do rapid cycle learning on their own. So some things that they could think about, and some things that we've touched on in this presentation, like, how long should my learning cycles or my improvement cycles be, and those sorts of things. As Kara mentioned, the 2-generation mutual reinforcement tool is available. both again in hard copy and as an Excel workbook that has all of these complicated formulas in it to give you a nice score. And we have a brief that and demonstration videos that walk you through how to use that tool again with your team. And if you are interested in the really detailed nuts and bolts of the NS2G project, we have a final study report that really, I think, is like a great resource to talk about the whole process that we used for the formative evaluations, details from each of the initiatives, logic models, what specific things they worked on, and what they learned. So all of these resources are available now. You can follow the QR code on the screen, or you can see the link and get access to all of those. So I think I gave you the long answer to your question, Laura, but the short answer is yes, they are available now. So we want to thank you for attending today. I think we do have a few minutes left if there are any final questions, but I'll leave this up here. If you leave the webinar and you think, oh, I really wanted to know that, we have some contact information on the screen. There's my contact information as well as Nikki and Kara, and our OPRE project officers, Kathleen and Aaron. And Mary, yes, that QR code goes to the same link in the chat that Kathleen provided.